Now it's showing live on Facebook, Paula. Do you want to check on Facebook first?
Yes.
Yeah, now I think it's live.
Yes. Yes, it is live.
It is live? Okay.
Yes, yes.
Fine.
Sorry, panelists.
Sorry, everybody. I think there were some technical issues, so we are live streaming a bit late on Facebook. So I'll just like to reintroduce all the panelists. To start with, Dr. Shrikant Bharadwaj is from LV Prasad Eye Institute. He is the director of Brian Holden Institute of Optometry and Vision Science, graduate from Elite School of Optometry, did his PhD at University of California, Berkeley, and went on to do his postdoctoral at University of Indiana. He also has set up his own lab in terms of optics and binocular vision at LVP. He is also on the editorial board of prestigious journals like Optometry and Vision Science, as well as Nature. So welcome, Shrikant.
Thank you, Lakshmi.
Noor is, adventurous person. He's joining us from the highway, parked in his car in the side, traveling to Delhi. Thanks, Noor, for joining us from there. And he's a graduate from Jamia Hamdard, did his master's at Lotus, currently just graduated from his PhD from Chitkara University, an educator at Chitkara, as well as a clinician at Shankara Hospital, Ludhiana. Aditi is an educator at Bharati Vidya Peeth, and she's also a fellow of the American Academy. Maheshwari graduated from Elite School, and until recently was a faculty of Sri Prakash College of Optometry. And now she's into innovation and having her own company in terms of innovation in optometry. So welcome to all the panelists, and thank you for putting up with all the technical issues as well. Aditi, if you can represent your just maybe in a nutshell, present about your poster. Aditi did a small study with all the optometrists to look at barriers in research, and she'll be presenting her data, which was also presented at the American Academy this year. Aditi, can you share your screen?
Yes. Yes.
I think your slideshow, because you ended with that slide, it's still there. So if you can just go on to the first slide. Yeah, go on to the first slide. Yeah, that's right. Yeah, that's right. Yeah.
On this blind date, I just, there was a thought came in mind on research. Research is to see what everybody else has seen and is to think that nobody else has thought. So this led us to identify the potential barriers and the perception of Indian optometrists on research in the field of optometry. So there was a small study done, and this study was it was not possible without help of Mr. Nilesh Chite and Mr. Chinmay Deshpande. We took the 447 participants in our survey because there was no published data from India to explain the inclination of Indian optometrists towards research. So with the survey included the fundamental information regarding the participants, their experience, then the highest qualification of their education, and also the mode of practice. So we took the prospective areas of research amongst them. So we could find out that the clinical research and the public health research was on demand, and the others area were on neglected side. Talking about potential barriers, the topmost potential barriers we could list out was where finding the topic specific supervisor, getting the financial support, choosing right methodology, and use of statistical test and analysis. So people who are working in the private practice or the optometrists who are working in the corporate, they felt that the searching topic specific supervising, finding study subject, then the choosing right methodology, staying motivated and working on the plan, management of data, these are also uh, potential barriers for conducting the research. And their qualification is up to bachelor's and they were having the experience less than 5 years. So talking about perception towards the research, we had a participants who had a prior experience of research, and we do not have a prior experience of research. So they thought of that the peer were optometrists who were having no prior experience of research. They thought of that research is conducted in only clinic, and research is always conducted under supervision of research scientists. But the optometrists who were having the prior experience of research, they thought they disagree this statement, and they also think that research has no role to play in the private practice. This statement was disagreed by optometrists who were having the prior experience, and this subject of research should be taught in the bachelor of curriculum itself. This was thought which was carried out by the optometrists which are having the qualification masters and the above. So this, to conclude, the study yielded an insight into the barriers and perception regarding the research in Indian optometry. So we should strongly needing strategies to develop to overcome all these barriers. So this was a small study we conducted, and we also presented at the academy. And this was a questionnaire we distributed among the optometrists.
Okay. Thanks, Aditi,
Thank you.
for that very quick summary. So just with that background of what Aditi presented, I'll just like to ask all the panelists, if you have to, name one single most important, I would say, I would not call it as a barrier, but one single most important limitation in terms of youngsters not, having an open mind to research in optometry, what would you think it is? You want to start, Shrikant? Then maybe the others.
Yeah. I think the biggest barrier is like what Aditi's study indicated, it is the lack of proper exposure to what research is in the undergraduate training curriculum. Because once that is provided, I think several of the myths that are existing about research is going to get cleared out.
Noor?
I believe when the students are at undergrad, they had certain various mindsets. They always think that research is something which is difficult. Uh, one uh, One thing that I have noticed that students lack consistency. Or in the beginning they wanted to do the research, but over a period of time they miss or they just their energies or their interest drops down. So I think over here the faculty or the institution has a greater role to play, that the aim and objective should be clear to the student. So it should not be like just for the sake of passing the exams. If they are doing, so definitely usually they lack energy and the interest over a period of time.
Maheshwari, what's your take?
Yeah, so I will tell you the barrier and also the solution. Mainly, what we saw that institutional support to the students, because when you there are some research centers, but some of the hospitals are not research centers, and their main motive is like customer satisfaction, and they want to send the patient soon. And if the patient's waiting time is increasing, they were like, no, for your project, why are you delaying the patient? So mainly we have seen a lot of institutional support was the issue. So I'll just tell you a quick solution for this. What I did is, I tried this, and since I was not getting institutional support, I just collaborated with an ophthalmologist, and it worked wonderfully well. So the ophthalmologist is also becoming one of the author, and your students are also becoming author, and you will be one of the author. No, this is a win-win situation. After that, I just saw that everything went smoothly. So this could be one of the thing that people can apply and see.
Okay. Noor, just coming to you, since you're a recent PhD among all the panelists, so I just wanted to ask you, when you approached, doing your PhD or taking up a thesis and things like that, what was the mindset, and what do you think is the mindset in terms of students? Do they think that, oh, if you have to do all of this, you should have a lab, you should have test tubes, and that is what is called as research? Or that myth is no longer true among students? What do you think?
I would agree, somehow I may not agree to think that research is something can they are into the academics. Once they are into the clinics, I think they try to learn the other aspects of the research. I believe that there are the various types of the research that can be doable. Of course, our teaching, the institution should have us facilities to promote. The best part of the optometry is that it involves patient care and the clinical setup. So even the research can be done in their clinics. It can be done on the community level. It can be done a kind of survey. The only thing they should be careful of, that it should be some innovative. It should be, I mean, some unanswered question should be there. So I think again, I feel like, I mean, the good literature study and the survey is needed for any kind of research. For me also, when I had enrolled, first of all, I mean, it appears like everybody wants.
You're muted, Noor. I think you suddenly went into
An
mute.
objective is a
Okay.
main thing that one should be doing. So I had to struggle, but ultimately, once you are thorough with your objective, I think the end result will always be fruitful.
Okay. Shrikant, the current UGC norms kind of are getting stricter in terms of the faculty of the optometry colleges have to be PhDs or postgraduates, and it's going in that direction. I guess they will very soon be implemented also, strictly implemented in most of the institutes. That's what we are seeing on the ground. With that in mind, and also with your current lab and other things that you're working with in an institute, where do you think the colleges should kind of improve their kind of facilities and stuff, in terms of in case their own faculty are doing PhDs or some kind of research? I'm not naming it as clinical or lab oriented. I'm just leaving it open ended for you to kind of say, the different avenues that the colleges can improve in that direction. And that also becomes a kind of a teaching for the students as well.
Yeah. I think fundamentally, Lakshmi, one thing that institutions should realize is that research is not a money-making venture. It is actually a money-draining entity, and the returns that you are going to get is not always financially tangible. The returns are usually in terms of the papers that you're going to get or patents that might eventually get filed. So there are intangible returns to research. Now, therefore, research should be thought of as an investment made by an institute, and the investment has to be in twofold, I think. One is on the human resource that will be fundamentally required for building research projects, and secondly, also on the infrastructure that's needed to support the research activities. I will put human resource ahead of the infrastructure because it's the human resource that will drive the research. You can have really fancy buildings and fancy equipments and stuff, but if you do not have the right kind of people to ask questions, then these things are essentially, wasted. So I think from an even here at LVP, what we currently have in terms of research labs and stuff didn't exist all the way from the beginning. These were slowly put together because people came in and they wanted to do certain things, and towards that we have been systematically building this. So a organization that is thinking of investing in research, I think should first find an appropriate individual who can come and drive that research entity. And comes with that individual is a set of requirements for their lab or their facility that they are looking at. And slowly only from and that individual will be supported by a little bit by a few students and by some clinical collaborators, and that is how that group is going to get built. Once you have one fully functional active lab that is working, publishing papers and stuff, that will automatically attract more people to come and join. uh, there is usually a people end up asking that, well, what is, this is specifically for individuals who are pursuing their research or things abroad and they were thinking of coming back. The common question asked is, well, we do not have anything in India, why should we come back? Now, my answer to that is, why should something exist for you to come? Why is buildings going to be put up before you come up? You come, you show us what you want to do, and then investments can be made. So I always tend to put human resource ahead of infrastructure needs.
I think that was a very good point initially when you said that, institutions or optometric colleges should not look at it as a money-making venture, but a money-draining one. And I think not only in terms of papers, even in terms of a setup, if you're setting up, let's say, a binocular vision, lab, or let's say cornea investigation lab or anything, it is an investment which would drive the future. So I think
Absolutely.
that is more positive, and that is also a learning experience for all the students. So I think the educational
Absolutely.
institutions should see in terms of that is investing in training more than anything else in terms of
Yes. Yes.
receiving money.
Yeah.
Maheshwari, I just there is a comment on Facebook which Preeta has said that students also kind of don't know the advantages of reading journals and or looking at publications, and how useful it's going to be to have that knowledge even when they apply for jobs and things like that. Now, you've been an educator. I just wanted to ask you in two questions. One is most of the undergraduates, sometimes when I see them, they kind of do projects just for the sake of doing, and there's nothing new that comes out of that particular study or whatever they're doing. That is number one. How do we kind of change that? And the following question to that itself is, how do you kind of, because you've got into this niche of innovation and optometry and all of that. So how would you, what would be your message in terms of practicing optometrists and practitioners who think that, no, research is not something that I can do sitting in my practice?
Yeah. So I had this, am I audible?
Yes, you are. Go on.
Am I audible? Yeah.
Yes.
So I had this issue when we initially started the research methodology as one of the subject, and when we started doing this, we had this issue. So we had issues from, mainly we saw that the student motivation was not there. I saw that, but suddenly they will not get motivated. So I also see other supporting environment was not there. That is why they were not getting motivated. So there are few things I just changed, and after that it worked well. So one is, doing the project in the third year or fourth year. We always used to have a debate on this, and I strongly recommend do the project in the third year. So doing the project in the fourth year always failed because they were not having time, other clinical pressure was there. So this change I made it. After that it worked out very well. So another thing is, the student in their mind, they are having a lot of barrier because they think that research is, something very difficult. So I would recommend, a lot of online courses are coming now, because the research centers like LBPA and all, they have good setup for there are mentors to teach. And but the other small colleges, they can avail this opportunity. So please stay till the end of the session. I'll be posting a lot of online free courses from esteemed institutions like Harvard University and Stanford University. So once they nowadays, anybody can connect with anybody in the globe, so this connection can be done. So and also to inspire the student, as faculties, we should achieve something, so that they get inspired and they want to do something like that. So another thing to inspire them, we can give them at the end of we are giving outstanding student award. So we have to give equal importance for outstanding research project submission. So this will definitely motivate them. Just simple one example I'll tell you. So one of our student grant proposal was accepted by IVI. So the IVI newsletter, the student photograph came. The student was very happy, and the student's mother was very happy. They called me. This is a small recognition. Like they become very, very happy. So the parents came and saw me, and then they thanked me. So my daughter's photo came in some other journal or something like that. It's very simple thing we did. So they it makes them very, very happy. So if we give them awards, even OCI can, from all over the India, we can assess and won a best project award from student side. So we can give encouragement, and slowly we can bring them into research.
Yeah, that's a very good suggestion, Maheshwari. And I think what you're saying, there has to be some carrot and some motivation, I guess. And what you said was, I think, very, very true in terms of recognizing people who have that aptitude, to get into research. Aditi, I just want to ask you something. In your study data very clearly said that, we didn't get educated about statistics, or we don't know about, how to conduct research and things like that. That came out very, very clearly. At the same time, we also have in our curriculum research methodology and statistics, which the students think is the most boring subjects, and their interest towards that is, very, very narrow. So you have here, you have the solution. At the same time, people are coming up with the same problem. So what do you think is, what is lacking, you think?
So what I feel is, your teaching, first of all, as an educator, I feel that your teaching should be a research-based teaching. Means when you teach any subject, it should be research oriented. Means you should have a background of some of the reviews of literature with you, and you can just correlate those findings while teaching that subject. So if you're
Basically evidence-based.
yeah,
Everything should be evidence-based. Yeah,
yeah,
absolutely. Yeah.
and the second most important thing, that you should ask students to do it in a small group. So we can have the second year students, third year students. From there itself, we can start study that would be motivated to them, so that a small group study would be helpful for them. Because what happens, they feel that now I have to work on the patients. When I go in the final year, I had to see the patient, I had to do project for the patients. So they might be scared of doing the projects on real patient. So why can't we just demo in your class? So just asking them to be in a small group, and we can have a research project. So there are multiple projects can be done in small group. So I think that a small group evidence based teaching, and that will be motivating factor for the students. This is what I feel.
Okay. So you're saying kind of sow the seed maybe right from second year and things like that, so that by the time they come to the end of third year and internship, they're more prepared to do more kind of, questions are asked where they want to do some kind of study.
Yes.
So that's good as well. Noor, coming to you, having gone through the process of PhD just recently, what do you think your perspective? I mean, where do you think has changed? What has the studies that you've done and all of that? What has changed in terms of your outlook to eye care and towards optometry? So, what are the learnings that happened in that process? You're muted, Noor. You're muted.
I would say for any research, I mean, there is some outcome. I feel like there is nothing failure. I mean, you learn from everything, even if your conclusion is not what you expect or what you think of. Everything will have some positive impact. For me also, I had to struggle a lot because I mean, during my thesis project, I had to do one test for the mimography, and which was quite expensive, and I was not getting the funding and other things. So finally, we decided to work on it, and we came up with the mimograph, which is non-contact and a portable mimograph. And this when something which troubles you, it also give you a way to think out of the box, and it will leads to some another path which will have which will be more fruitful. I think doing a research or a PhD makes you, or any kind of research makes you more goal oriented, because this is something when you take up, you take up it as a challenge. The path is not small. Usually it takes years to complete the things, and you go through a various phases of the program, and all these will have some kind of learning. You are when once your goal or once your objective is understandable, you are more motivated to explore the things, and you are eagerly wait for what will come out of it, and that also leads a path and a way for other researchers to conduct something for the future. So I think there is a lot of learning. This is not only for the PhD, but for any research. If you are doing with honesty, with following some standard way and with the ethics, I think that is what is required in the optometry. That is what is required in the healthcare.
Thank you. Maheshwari, when it comes to publication, Fakhruddin has also raised this on Facebook. He says that, we all do a lot of studies and research and all of that. But when it comes to writing, many of them kind of fall back, saying that because, see, it's very easy for others outside India because that's their mother tongue. They think in English, they write English and all of that. But for many of us, we tend to think, like for me, I might think in Tamil or something like that. It's very different for us when it comes to writing. It needs a certain amount of skill, and you need some kind of experience over time to actually do that. So what's your take, Maheshwari, when it comes to, like, for example, I'll just say about my own case. When I was at LVP and all of that, I had no qualms about working and doing and collecting data and all of that. But the moment somebody told me write it up, I would go into this cocoon and say, oh my God, I'm not just doing this. That fear, that's always there, and I see that even in a lot of students, not only the ones in India. I'm talking even like when our students go outside, that is also the fear outside. So what's your take, Maheshwari?
Okay, so I will tell you my journey, how I went into the writing. So So I was interested in writing, and then I wrote myself, and I read what I wrote. So it was very, it is not up to the mark how we see in the published articles. So if you are doing a PhD, or people who are abroad, they have a lot of exposure. Like you write it, and somebody is reviewing it and giving you a comment. So this is how we learn. Okay, but in my case, there was nobody like that. No, I had to learn myself. So what I did is I enrolled for the courses. There are no, if you just type writing in science in Coursera. So I'm just telling you, for example, there are a lot of courses available. So I just did a course in Coursera. After that, it was all practical examples. After that, what I did is I wrote myself and corrected by myself. And another thing, what I did is there are softwares available which will correct your thing. So this you can use it as a beginner. So that is the second thing. And the third most important thing is the patience, because why I'm telling you is, when we were apart from the publications, so I was like into writing for FDA documentation, and FDA things are more difficult. No, we submitted nearly 3,000 page documents to FDA, so out of which around 500 pages I myself wrote. So why I told you the patience is, there was somebody who was from US, a consultant who has experience with FDA. He was correcting my writing. So whenever I send a paper, he will give his comments and send it back to me. So then I do some corrections and send it back to him, and he will do some correction and send it back to me. So the process is, somewhat painful. So many times your paper is coming back with a lot of comments. It's really painful. So but this pain is worth undergoing it. So I will request everybody, this will be painful only, the comments are really painful only, but patiently, because everybody does this problem, everybody's paper gets rejected. So I have gone through this. Sometimes I used to cry also. I have gone through this, but it's worth undergoing this. I have got a lot of comments, but it's good. Once the FDA approval came, I know our device, the device which we worked for 3 years, now it is, yeah, now you can sell it in US. So when
Okay, I think her connection went off.
Yeah.
That is, I think, one of the major barriers, Shrikant, don't you think, when it comes to writing, one of the major barriers in terms of youngsters who might actually be a very good researcher in terms of, doing studies and collecting data and have that passion at the same time. So I feel that, the support also needs to come from the institutes in terms of, providing that support and help in terms of writing it up.
Yeah. There are again two angles to this, Lakshmi. One is the English angle to things, and then there is the science communication angle to this.
Absolutely.
So
Yeah.
the
Yes.
English angle is what I think all of us are saying, that we are not native English speakers
Yes.
and whatnot. Even today, when I send out my papers, there are sometimes comments from the reviewers saying that, well, you should probably run it by an English writer. And I think sometimes they are biased because they look at your address and then make these kinds of comments about things. But I
Yes.
think probably what is more relevant for discussing is the clarity in science communication. And that, I think, comes if you have clarity in your own thought process. And oftentimes we do not think through things. We tend to make jumps in our thought process when we are conducting experiments or collecting data and whatnot. That's oftentimes are the barriers for us to effectively put it down on paper and communicate it on paper. What I always do with my students in the lab is the research protocol that gets put together. We spend a lot of time putting that protocol together, and as clearly as it can get, you write the protocol. You not only refine the English but also refine the thinking process behind it, to the extent that the hypothesis, the exact question that you are asking, is all very, very, very clearly laid out. And then the data collection becomes very, very easy. in the sense that you now have a very targeted question for which you are collecting the data. So any project in my lab, if it has come to a data collection stage, then 70% of the project is already over. So I usually do not rush into data collection at all. And this helps in the later part because you now have most of the written documentation already written up. It's only a question of tying it all together in terms of the introduction needs to flow into the methods and into the results and discussion and things like that. So I think while the institutions can support you with English writers and language editors, the clarity in thought process is something that needs to come on your own, and that will have to happen only with you and your mentors. So
Absolutely agree.
so that's something that needs to, yeah.
Yeah. So I was, as you were talking, I was also thinking that when you're writing the protocol, all your literature review is also done,
Yes,
So
yes,
I
absolutely.
mean, if at all you publish that, your introduction and everything should be coming out from whatever you've already worked
Yeah,
on for the protocol,
yeah,
which is actually the most difficult part. The introduction and the discussion are the most
discussion,
difficult part.
correct.
All the others, generally, everybody gets a very good flow because that is basically what you've done
Yeah,
in terms of
yeah,
your study. The
yeah,
objective, the methods, and results are just written. You're just going to write whatever you've done.
correct.
So it's the introduction and the discussion which
Yeah,
is the most
yeah.
difficult in terms of.
Yeah, and just as a strategy, perhaps for early writers, it's a very well-known phenomena that you have a writer's block. If you open a Word document and there is an empty page in front of you, you just don't know where to start writing from.
Yeah.
So what I tend to do is two things again. I write something called as a brain dump document. So a brain dump is whatever that is there in your brain related to that project, related to that paper. You just write it down. It doesn't have to be well-formed sentences. Doesn't have to be grammatically correct. Doesn't have to be in an order. But there is information that is there on the piece of paper now. So that one helps you sort of say that, okay, these are all the things I need to cover one way or the other in the paper. The second is, I tell this to the students, is to start writing the methods and the results first. So put in placeholders for introduction, abstract, and all of that, but then start filling in the methods and the results, because that's, like you said, that's the relatively easy part of the paper. You have done this, you have got this, so you can write that up. Then fill up the introduction and the discussion section. So these two has worked quite nicely for papers in my lab.
Okay.
Yeah.
Okay. That's great. Aditi, just coming over to you, and maybe Noor can also step in. We always get these get students who come and say that I want to be involved in this particular project that is going on. Okay. Or come and say that I want to do research, but I don't know what to do. So what do you answer to such students?
First of all, this problem come in final year because we generally give them submission or the project to do. And when they see patient, they think that, no, I should do project on this topic. This is very good topic. So they get motivated to do the project. But the question came in the mind that how should I do it? Then they call me that, madam, we don't know how to do it. So the answer for this question I give generally is that, first of all, you should see multiple patients with the same scenario and just thought of various conditions relate to so the question can come in your mind that if you see this condition, then which questions come in your mind, that what are the outcomes you are finding it out. So once your outcome is ready with you, then you can start thinking of your research question. So once your research question is ready, then you can think of your methodology, because methodology, what your patients are there in front of you. So you already done the method, but research question should came there in their mind, that now by seeing this patient, what are the outcomes I'm getting it. So I just start asking them to look at the results part. So once they do the investigations, once they are doing the investigation, they have a data in with them. So I just start asking them to collecting that data and just start making up the questions. So with those questions, they can actually start thinking up the research question.
So
This,
basically, you tell them that they have to know what exactly they want to find out. That has to come from the student itself and not from somebody else. I think that's a very good, valid point. Unless and until it comes from them, they won't be motivated to do it, and they may not be doing a good job as well in terms of conducting the study. Noor, any comments on this? Actually, Noor, I'm reminded of the email that I sent you when you were about to join PhD.
there was just addition before Dr. Noor will be joining. Just the same happened with me for the fellow for FAO paper, because what happened, the credit points were less, and I had to do the 6,000 word paper, and I was very it was very tough for me to write down the 6,000 word papers, and the supervisor actually helped me a lot in that session, because it was not a research paper. It was just a topic, and I had to submit that topic. It was on pediatric low vision care. So that's how the coordinator helped me. So that was a collaborative effort. So this was point I would just like to introduce.
Yeah, yeah. Yes, Noor. Again, you're muted, Noor.
Sorry. One common observation that we as a faculty observe, that many a times, most of the time, student comes that they want to do research, but they don't have a topic, they don't have anything to do, and they request the institute or the faculty to suggest something for them. I think this may not be correct in all sense, because you may not understand the level of the students. I usually tell the student to, even if I give something, uh, any suggest any topics, I ask them to do some study, literature search, and find out, how this can be done. Once they are prepared, they come to know whether they are interested in doing it, or they are interested in something else. So I think the level of interest is very much important for the research, and we should be knowing that, otherwise the research will be of no use, because we keep on doing the research, but we don't land up to its final conclusion, like to the publication and other things. The institute should provide some help in terms of publications, whether it's a funding, whether it's sir mentioned about the writing and other things. These all things needs to be done. We cannot leave entire things on the students, but again, the effort should be there from the student side also. I still remember the longest email that I had received once I had requested for some topic for the PhD. But that's something I tell others that this is your research. This is what you are going to do. You have to think what you want to do. You have to come up with the topics, and you can get the suggestions from your faculty. You cannot take the topic and then decide. You take a suggestions and take the suggestions, and based on that you can work ahead. So I think that was quite motivating.
Yeah, I think there's also a very valid comment from Zishan from Ansel University. He says a lot of research and a lot of projects have been done by many of the institutions, but nothing is of the standard that where it can go to publication and things like that. And I think we kind of discussed that. Zishan, that's because they are. It's not a new question. I think people sometimes already do things which is already published and already established. Those facts are again redug sometimes by students, so that doesn't become of publishable value because it's already a proven fact in terms of science. And for one of them who's asked what is research, I think it's in the word itself, research. So you're looking for answers to questions in science, not only in optometry, but anything in science. I think when you're looking for answers to a particular question, that's what research means. It can be, patient-based, it can be lab-based, it can even be just based on looking at previous journals and, coming up with some kind of an answer to all the published data previously, which you call as a review article. So all this is all, research. I just want to ask a question to both Shrikant and Maheshwari, as both of you are well experienced. So if you had to give, let's say, a one-line suggestion, both to the institute as well as one-line suggestion to the students, what would that be in terms of the educational institution and one for the students? Shrikant, you go first, and then I'll ask Maheshwari.
I think to the educational institution, I would say that start inculcating evidence-based practice in your teaching, because once you get the students to start looking for evidence, many of the issues that you spoke of, Lakshmi, will be automatically answered. They would not go back and dig out answers that are already very well known in the literature. Many of those questions are coming up because they are ignorant of what is already published out there.
Yeah,
For
absolutely.
for the students, I would say that do not think of any question as a stupid question. Ask that question, but be prepared that these questions would have already been answered by somebody. So we don't feel disheartened that every question that I am asking has already been answered. It's good that then you are asking the right kind of question. Even now, after having spent close to 20-25 years doing this business, every time I ask a question, I find that 1 of 10 people in the world have already answered it, and they constantly belong to my hate list, because they've already done what I'm thinking of doing. But that's good, because you have an opportunity to build on what they have done. So don't feel disheartened just because the question you have asked is already done by someone else.
Maheshwari, what would you
Yeah.
say to educational institutions and to students?
Yeah. For educational institutions, the research is, in India, it is slowly coming up. It is new for India. So we will not get everything in a day. It will come slowly only. So the educational institutes should understand this, and nowadays everybody is doing research, and the research culture is slowly coming up. So in this team, we can easily go up. So for the educational institutions right now, immediately, no, immediate thing that we can do, only thing is, motivate them and inspire them and giving them awards, and maybe if you tell that student to do an online course, if the student has done an online course, maybe when the certificate comes, stick that certificate in the notice board, something like that. So encourage the student in all possible way, put the student's photograph, she has done this research, encourage the student in all the possible way. So the research is not a priority in most of the institutions. So I request them that they have to give some priority, and time. So for mainly the students are struggling, they every day they have some test exams, internal exam, viva and all that, and they don't get time. So I will request them to give some time, in a week, maybe 1 day or 2 days, you only do the project. So today you do literature review and come back, so you just leave them free. And if they are doing project in groups, so make them sit in the groups, and they will friendly chat and come up with some innovative ideas. So leaving them free, and we see, it is like school practice every day, giving test exams, such things, and they will only concentrate on this. And in the students mind also, the research will be very less priority thing. For the students, I will say, research is not a boring thing. It's very, very interesting. From my experience, what I will say is, I have never done what I have done yesterday. Every day I'm doing something new, solving new problem. Life is really exciting. So research, and especially innovation, is worth taking as a career. It's really exciting. So I will advise these young people to explore new things. So it's interesting.
Thank you. So I guess, from what Aditi presented and from all your comments that I've got, I can maybe look at just, summarizing a few. So one thing that came out is you have to kind of handhold them to a certain extent. the students who are actually motivated, encourage them. And maybe, you know, having regular journal clubs would be also a factor, where you are going through latest articles, telling them what are the findings and stuff like that. And that actually, you know, ties in very well with evidence-based teaching, what Aditi was saying. So everything, when it is related to publications and evidence, then the students also know the importance of, you know, asking a question and finding answers to these. So I think that kind of, you know, all falls into a very good, what should I say, a string, in terms of, you know, how the entire chain goes, starting from evidence-based and then motivating them and all of that. That then leads to students becoming more and more encouraged to do studies and research. So thanks. I think we've kind of, you know, overrun our time. Thanks to all of you, and Noor, especially you, you know, patiently sitting in the side of the highway and connecting to us. Thank you for that. Thanks for all your time. I know all of you are very busy people, so thanks for giving a Saturday evening towards this call. And I'll also share the link with all of you, so that you can also share with your students and your colleagues, so that they can also listen to this. Maheshwari, you can actually put all the links that you said.
Yes, there are excellent online courses which are available free of cost. I'll be posting the link in the comment box. Thank you all for patient listening. Thank you, OCA, for the opportunity.
Thank you. Thanks a lot, everybody.
Everyone. Thank you, OCA.
Thank you very much.
Thank you.